Ako, Eugenio Jalino Jr. o mas kilala sa tawag na Teacher Eugene o Eugene Waraynon. Usang magturot-do, proud Waraynon.
Hello mga kamapelyas, especially our grade 9 learners. How are you? Again, I am Teacher Eugene, a math teacher of the Ranting National High School Division of Eastern Samar. For today's video, we will talk about the risk and protective factors in substance use, abuse, and drug dependence. Are you ready? To test your knowledge about this topic, let's have this activity. Understand the following statement, either it is a risk factor or protective factor. Put a check in its appropriate column. Number 1, high emotional distress. Number 2, parental involvement. Number 3, faith-based resources. Number 4, poverty. Number 5, family conflict. Number 6, involvement in social activity. Number 7, afflictions with deviant peers. Number 8, low IQ. Number 9, cultural influences. And number 10, high unemployment. So how is that, kamapelyas? Let us check what we have answered. Risk factors are high emotional distress, poverty, family conflict, afflictions with deviant peers, low IQ, and high unemployment. While the protective factors are parental involvement, faith-based resources, involvement in social activity, and cultural influences. To know more about the risk and protective factors in substance use, abuse, and drug dependence, be informed with our objective for today. To discuss the risk and protective factors in substance use, abuse, and drug dependence. There are many factors how the person lead to drug abuse. The use, misuse, and abuse of drugs are the result of various factors surrounding the person. These factors either increases or decrease the possibility of a person to use drugs. Risk factors are those influences which increase the chances of using, misusing, and abusing drugs. While protective factors, on the other hand, are those influences which decreases the chances of using, misusing, and abusing drugs. Do you know some of the risk factors? How about the protective factors? Let's find out on this activity. We have 5 domains here where he or she is surrounded with different factors. All you need to do is to classify the following factors if they are associated to risk factors or protective factors. Are you ready, grade 9? The first domain is personal, which includes the early aggressive behavior versus your self-control. Risk factors are use of drugs at an early age, risk-taking behavior, and experimentation. While protective factors, you will be protected through self-control behavior, good reasoning skills, excellent social skills, positive interaction with people, and sense of belonging. While for family, this includes how the weak parental guidance is versus strong parental guidance. Risk factors includes history and patterns of drug use. The attitudes also toward drug use and poor parenting and child rearing. While protective factors includes good communication with people, positive family relationship, and clear and consistent family rules. Another domain is peers and friends. This refers to the substance use versus academic excellence. Risk factors are association with peers and friends known to use gateway drugs. Example are the cigarettes and alcohol, and preference to stay with peers and friends rather than with family. However, you will be protected from peers if there is an association with peers and friends who do not use gateway drugs, the information of friendships, and reliance on friends for emotional support. Next is school. School has strong impact also to ourselves, especially to you. School may refer to the availability of drugs versus strong anti-drug policies. You will be at risk if you have a poor academic performance, lack of commitment to studies, poor attendance in school, and involvement in fights and conflict. However, you will be protected if you have good to excellent academic performance. You have joined or joins extracurricular activities and school organizations and choose interest in attending class. Your community you have lived in has also an impact towards you. This refers to the poverty versus strong community relationships. This may cover poverty versus strong community relationships. The risk factors are easy access to gateway drugs, poor community organization at neighborhood relationship, poor implementation of community laws, and negative attitude which favor drug use. However, you could be protected also by your community through having a strong community relationships, active and positive community programs, projects, activities for the youth, the positive attitude which combat drug use, and strong community advocacy against drugs. So those are the risk factors and protective factors that may lead you or prevent you from using, misusing. The National Survey on Drug Use and Health, formerly called the National Household Survey on Drug Abuse, but reported by the Substance Abuse and Mental Health Services Administration, indicate that some children aged 12 or 13 are already abusing drugs, and others begin earlier. The substances that are commonly abused are tobacco, alcohol, inhalants, marijuana, and prescription drugs such as sleeping pills and anti-anxiety medicines. If drug abuse persists into later adolescence, abusers typically become more heavily involved with marijuana and then advance to other drugs while continuing their abuse of tobacco and alcohol. Some individuals involved with drug abuse because of biological cause, wherein there is a family history of drug and alcohol abuse. And other individuals were influenced with drug abusing peers. Psychoactive, also called psychotropic, is a term that is applied to chemical substance that change a person's mental state by affecting the way the brain and nervous system work. This can lead to intoxication, which is often the main reason people choose to take psychoactive drugs. The changes in brain function experienced by people who use psychoactive substance affect their perceptions, moods, and or consciousness. There are 4 classifications of psychoactive substances. First is stimulants. Stimulants helps for the improvement in mood that can reach euphoria and bodily responses such as increased heart rate and blood pressure. Example of stimulants are caffeine, nicotine, amphetamines, and cocaine. However, excessive use of stimulants may cause irritability, mood swings, hallucination, chest pain, and even death. Psychoactive substance has beneficial effect on human body. Some people use the substance because They expect pleasure by avoiding of pain. But using psychoactive substances is also harmful if you use it in short or long term. Here are the categories of harmful effects of psychoactive substances. First is chronic health effects. This includes the alcohol, which lead you to have liver cirrhosis and a host of other chronic illness. Tobacco and cigarette form may cause lung cancer and emphysema. Heroin used by injection may cause also transmission of infectious agents such as HIV and hepatitis B and C virus. Next is acute or short-term biological health effects for opioids may cause overdose, and alcohol may cause physical coordination lead to accidents. Acute and social problem may cause sudden break in relationship and an arrest. While for chronic social problem may have default in working life and default in family roles. Did you understand our lesson for today, Kamapelyas? Grade 9 learners? Now, to test your understanding of our lesson, let's have this post-assessment by just responding to each statement with a true or false. Number 1, negative attitudes which favor drug use is a risk factor evolved around the community. Number 2, sense of belongingness is a positive way to combat self-isolation. Number 3, children are already using drugs at age 12 to 13 according to National Survey on Drug Use and Health. Number 4, the rest periods for drugs abuse are during major transitions in children's lives when they are in elementary grade. Number 5, poor parenting and child rearing can be strengthening by inconsistent family rules. Number 6, shows interest in attending class cannot ensure good attendance in school. 7, strong community relationships can easily access gateway drugs. 8, early adolescence is likely to encounter drugs for the first time. 9, the poor implementation of community laws will ignite the curiosity of adolescents to take drugs. And 10, poor social skills and interaction will help you fight against drugs abuse. So, how did you find it, grade 9? Did you learn something again today? Then if it does, kindly comment down your most likely learned from this lesson. Or if you still have additional input or clarification of the lesson, feel free to comment it down. Again, this is Teacher Eugene. Thank you so much for tuning in until the end. Hope to see you more only here on Eugene Warainen channel. Bye, Kamapelyas.